One of the key senators in this conversation, Ohio Senator Rob Portman. Thank you for joining us, Senator.
Hey, Shannon. Thanks for having me on.
All right, I want to start with a tweet just a couple of days ago from the president saying this: Republican senators will not let the American people down. Obamacare premiums and deductibles are way up. It was a lie and it is dead. Couple exclamation points in there. The speaker says he doesn't mind the pressure from the White House. How does it feel to you?
Oh, look, I think it's fine. I think there's a consensus among not just Republicans, but Republicans and Democrats that the law is not working. And even if Hillary Clinton had been elected and there had been a Democratic Senate, we'd have to be fixing the failing Affordable Care Act. Obamacare hasn't worked. Premiums have skyrocketed. So have deductibles. So have copays. And there's a lack of competition. In my own state of Ohio, about a third of our counties now only have one insurer in the private market. And many states, it's even worse. So this thing is collapsing of its own weight. However, the Senate is going to take a look at this legislation that the House sent over and put our own imprint on it, and that means improving it in certain ways. In my own state, we have a big concern over the expanded Medicaid population, because given particularly the opioid issue, the addiction, heroin, prescription drugs, now fentanyl, this is the first payer. It's the largest payer. About 50% of the cost of expanded Medicaid in Ohio is being used simply for substance abuse and mental health treatment. So we've got to be sure we aren't pulling the rug out from under those folks, and I think we can do that.
I know it's a big sticking point for senators on both sides of the aisle, the idea of that Medicaid expansion and how it does or doesn't continue, in what form. Another big issue are those state waivers that were tucked into the House bill that allow states flexibility with doing away with some of the mandates if they can satisfy certain requirements in getting that waiver. At least one conservative health policy analyst says the likelihood of those surviving the Senate version is very low. What other troublesome issues do you see with the House bill that may not work in the Senate, where you've got to craft a different kind of coalition?
Well, it's interesting. I think many of us in the Senate are actually looking for more flexibility to the states to be able to design the plans, to be able to come up with creative ways, including managed care, to cover people who are not currently covered. So in a way, the Senate's going to provide more flexibility, I believe. But in other ways, you're right, with regard to pre-existing conditions, a lot of us have a concern. We want to be able to assure our constituents that if a person has an illness that is catastrophic, or an illness that is something that would not permit them to get insurance because of that pre-existing condition, that they can get coverage. And so we want to make sure that that works. And there's discussion about taking the risk pools and changing those a bit, and other ideas. But I think it's an interesting situation for him, because we might provide more flexibility to the states to be able to design plans, because we know that over time that's going to result in better health care, that the government closer to the people is going to be helping to find out what works in that state to cover more people.
Bottom line, you talk about the failures, and a number of Republicans have cited these states and counties where people are left with little to no options across the board. Even Democrats, some of them, have acknowledged there are fixes that need to be done to the ACA. Can you actually craft something that's going to make a difference in the lives of real Americans who are trying to go to the doctor, trying to get coverage, no matter what their health issue is, pre-existing or something new or a catastrophic injury? And if so, is it something that will actually pass the House, where special provisions were cobbled together so that they could get the votes they needed?
Yeah. Shannon, I think that's a great question. And I think the answer is absolutely yes, we can do better. I mean, there's no question about it. And again, Democrats in a private moment and Republicans here on the Senate side all agree with that this system is not working as intended. It's certainly not covering the number of people it was intended. The costs have skyrocketed. You recall the costs were supposed to go down. They've gone up instead. Instead of being down $2,500, which was projected by President Obama, they've gone up by about $4,600 per family. 91% increase in Ohio in the individual market, the cost increase, 82% increase for small businesses. So this thing is not working as intended, and people haven't had the choice that they were promised. So people have lost their plan and lost their doctor. So I think we can do better by taking what the House has passed, improving it in certain ways, being sure that we aren't pulling the rug out from under people who are currently getting coverage. And at the end of the day, over time, begin to see these premiums and these copays and these deductibles level off and not continue to rise. This is the biggest problem we've got really in our economy, too, is that wages are flat and yet expenses are up, and the number one increased cost is health care.
Yeah, and a lot of uncertainty. Just yes or no, because we're out of time. Do you predict you'll get any Democratic votes in the Senate?
Too early to tell. I talked to one colleague yesterday, and I can't say yes or no because he can't say yes or no yet. It depends what's in it, but we're going to have to do it primarily with Republican votes, I'm afraid.
Of course. All right, Senator Rob Portman, part of that group of 12, the working group now that has a big task ahead. Thank you, sir, for your time.
Thanks, Shannon. Appreciate you.